episode of Making the Rounds, we'll be discussing complex joint replacement surgeries. This innovative program combines the latest in surgical technology with personalized patient care to help people regain mobility and live pain-free. To learn more about this topic or other orthopedic-related services provided at Banner Health, please visit bannerhealth.com/orthopedics. Making the Rounds dives into medical topics with those who know them best, healthcare providers. My name is Bridget, and I'll be your host for today's episode. If you're new to our podcast, thank you for tuning in. And if you're a regular listener, welcome back. Joining me today on Making the Rounds is a renowned orthopedic surgeon, Dr. Kirk Kindsfater. With over 29 years of experience and 33,000 successful joint replacements, Dr. Kindsfater and his dedicated team are bringing world-class expertise in hip and knee replacement to our community at the Joint Replacement Center of Northern Colorado at Banner Health. Thank you for joining me today, Dr. Kindsfater, on Making the Rounds.
Good morning, Bridget. How are you?
I'm doing well. Good morning and welcome. We are so excited to have you here today, and welcome to Banner Health. Could you tell us a little bit about yourself? You have an amazing background and an amazing experience in joint replacement surgery. Tell us a little bit about yourself and your background in orthopedic surgery.
Yeah, I've been a practicing orthopedic surgeon for nearly 30 years. Started a long time here in Northern Colorado. I've been here my entire career. I went to medical school in the University of Colorado in Denver, and I also did my orthopedic residency there as well. So I spent a good amount of time in Denver. And then I did what we call an adult reconstruction fellowship or a total joint fellowship at Harvard School of Medicine at the Brigham and Women's Hospital in Boston, which was a fantastic experience. And then I started my practice here in Fort Collins after my fellowship. I've had a really wonderful career here, taking care of thousands and thousands of patients. As you mentioned, I've done probably around 33,000 joint replacements now. Enjoyed it so much, taking care of these patients over the years. After 29 years, that's where I'm at.
Thank you for that overview, and thank you for sharing that extensive experience with us. And you mentioned fellowship training in joint replacement surgery. Dr. Kindsfater, could you tell us a little bit more about why fellowship training is so important in this field and how it really sets your team apart?
Yeah, well, for those listeners who don't know what fellowship training means, about our training. So we do our orthopedic residency, which typically is a 5-year residency where we learn about all orthopedics and how to take care of everything in the orthopedic world. But then those of us that want to specialize further often do a fellowship. So fellowship is an additional year usually where we go to an institution that specializes in certain areas of orthopedics. And you spend that year focusing just on that part of orthopedics. So during my fellowship, all we did really was primarily hip and knee replacement surgeries. So that when you come and you start practice, you feel like you have a better skill set than if you had not done a fellowship. And then that carries on during your career. If you focus on that one particular area and you do that over and over and over again, and you kind of immerse yourself in it, you go to all the joint replacement meetings, you read the joint replacement article, and you do lots and lots of surgeries, eventually you truly become an expert.
I want to talk a little bit about the types of procedures and specialization that you bring here to Banner Health. Could you walk us through the types of joint replacement procedures offered in the program? More specifically, what is the difference between primary and complex primary, and then the revision surgeries for hips and knees?
So I basically do 4 different kind of surgeries. We do primary hip and knee replacements. Primary meaning that's a patient that comes in, has never had a surgery before, or at least not a joint replacement surgery on their joint, but they come in with an arthritic knee or an arthritic hip. So they have their native bone and their native anatomy. Because of my expertise, I am referred a lot of patients that have more complex problems. Some of them may have had previous surgery on their knee, may have had an injury, may have had an ACL reconstruction, may have had many arthroscopies, might have had a fracture where they have some deformity around the joint. And those are more complex cases. You have to often do a bit more, and they're a bit more tricky than just your primary joint replacements. And then we do revisions. So there's a lot of people out there that have joint replacements in these days, and they can fail. They can, if they were put in many, many, many years ago, they can basically wear out. The components can loosen. People can get an infection. People fall and get a fracture around their prosthesis. Then we have to operate on them again. We call that a revision. And those are complex cases because they've already been operated on. They already have an implant in place. And that usually takes special expertise. A lot of surgeons who do primary joint replacements don't want to do revisions because of the complexity.
Surgery always isn't necessary. And just because you say you're a joint replacement surgeon doesn't mean that every patient that comes in is a surgical candidate. But you also treat arthritis. How do you decide when surgery is necessary versus more conservative treatments like injections or physical therapy, or maybe some of the other non surgical options that you provide in your practice?
Right. Well, we treat all levels of arthritis because arthritis doesn't usually just appear one day and you have a terribly arthritic joint. Usually it's a progressive process. So people often have mild symptoms initially, starting to affect their activities of daily living. They can't sleep at night, makes it harder for them to recreate. And we can see on the x-ray generally whether somebody has an arthritic joint. If somebody has complete loss of cartilage and they have complete bone on bone in their joint, then they have appropriate symptoms and they're a candidate for joint replacement surgery. But some people have bone on bone and they're still very functional. So I always tell patients, we don't operate on your x-ray, we operate on you. So we look at the x-ray and we can tell the patient, yes, you have arthritis, or yes, you have maybe early arthritis, but you're still quite functional. So we have other conservative options for those patients, including anti-inflammatories, activity modifications, corticosteroid injections. We have these, what we call to the patient lubricating shots now, or hyaluronic acid shots. And a lot of these modalities can, by people that have early arthritis or moderate arthritis, can give them symptom relief so they can stay active, but they don't have to have a joint replacement until either their pain or their function becomes such that they're really being limited, and then they're appropriate to have a joint replacement surgery.
Can you tell us a little bit more about, some of those guided technologies such as computer guided navigation or image based guidance, and how does that really enhance your surgical outcomes?
Well, so orthopedics lends itself a lot to technologies, advancing technologies, and we have some wonderful technologies. We keep making advances. And today we have a lot of different technologies that involve uh, imaging in the operating room, and then basically a computer that helps guide us, and it can give us additional information. It can help us to align the knee. It can help us to balance the knee. We have robotic surgeries these days where a robot can actually do some of the cutting and try to help do some of the balancing. So these are fantastic technologies, and it just gives us another tool in our armamentarium to provide the patient with a good outcome, because they're complex surgeries. A knee or hip replacement can take 100 steps in the operating room. So we want to, any technology that we use that can help us to get the proper alignment and balance and do those steps more repetitively or reproducibly is going to help us to give the patient a better outcome.
And you mentioned, there are joint replacements now that, an active patient can have for 25 years. So as we're talking about those materials, what role do those materials like the advanced components and the 3D printing, how do they play in that durability and longevity of joint replacement?
My hip and knee patients, I pretty much let them do almost everything they want to do. I counseled them maybe to avoid a significant amount of impact. So if you want to go run a marathon, maybe not the best idea. But almost everything else, and other than maybe, you know, running and jumping where you have a really high level of loading, that can be a little bit hard on the bear end. But other than that, you can be tremendously active. You can walk, you can exercise, you can ride your bike 100 miles a week, you can ski, you can play tennis. So the bearings are really great. They're very durable. But the other part of the implant is the fixation to the bone. So these implants have to fixate to the bone. And it used to be in the past, and we still do it to some degree, that we would use what we call a bone cement, which is an epoxy, which actually attaches the component to the bone. But that could be a weak link in some patients as they get 15, 20, 25 years out from surgery. Occasionally that bone interface will break down. So we're currently going a lot more towards what we call ingrowth prosthetics. So the bone will actually grow into the prosthesis and weld to it. And once it does that, that fixation can be tremendously durable and may never fail. It may last a patient their lifetime. New manufacturing techniques where we can do 3D printing, for example, we can make very complex shapes, and we can make a shape on the implant that mimics bone. So the body sees that as being very friendly, and it helps the bone to grow into the implant. So these new techniques have been really great for some of our prosthetic components. We can make them more complex, and we can make them with a surface that helps us to guarantee the bone is going to attach to the prosthesis.
Well, wonderful. So when we're talking about the outcomes, and we're talking about some of these patients that, these are your prime candidates, can you walk us through, Dr. Kinspatter, some of those patients that may not be a candidate for joint replacement surgery?
There are some factors and medical factors that make joint replacement surgery more risky. We know that from a lot of the studies that we have done. A big one, obviously, is obesity. Diabetes is another thing. You need to have your diabetes under control. If it's not, infection rates go up, complication rates go up. Cardiac disease, pulmonary disease, we always explore that with the patient. If they have past history, we will always make sure that they're as optimized as they can be with their primary care provider or with their cardiologist or their pulmonologist. And some people, uh, especially as we get older, for example, we can get somebody who's very frail, not very active, maybe have multiple medical problems. Sometimes they're not a great candidate for surgery. And so those patients are better treated with conservative modalities, activity modifications, steroid or hyaluronic acid injections. We do have other things we can offer them. So, but we look at the patient as a whole, and we make an appropriate decision. Are you an appropriate surgical candidate? Fortunately, for most people that have significant arthritis, most of them we can get through the surgery just fine and very safely. But there are exceptions.
And Dr. Kinsfater, in our previous conversation, I loved how you called yourself a privatemic. You were an academic in a private setting, and I that just so resonated with me, and really shows your experience and your dedication and your focus on research. And I'd love for you to share with us a little bit, how do you leverage those patient outcomes, and that data from your registry to really continuously improve the program and the work and the surgical techniques that you provide to your patients?
Right. So I've always been interested in the academic side of things. I think now I've done over 20 different clinical studies with the orthopedic companies. And within a couple of years of when I started a joint registry. So every patient that comes in to see us, we have them fill out paperwork. We have joint specific questionnaires. And I now have about probably 23 or 24,000 patients in this joint registry. So there's a huge data bank there with all kinds of data about how the patients do, what are their outcomes, and we tie that back to the implants that we use. So over the years, through all these studies, and a lot of these are multi-site studies as well, because other surgeons have contributed to this. But we've been able to gather this data, and we can look back what implant performs well, what's the survivorship of the implant, is the range of motion of this particular knee implant good, is the stability of this implant good. It's a very powerful tool that we use to help further the science of orthopedics, which is good for the patient.
Any final thoughts or anything that you're currently working on right now that you're really looking forward to into this next year, or that you plan on bringing to Banner Health?
From our standpoint and bringing our team over to the Joint Replacement Center in Northern Colorado and Banner, our goal really is to make this a destination place for people that want a joint replacement or are having problems with their joint replacement. We want Banner here in Northern Colorado and the Joint Replacement Center to be the center of expertise. We want to turn Banner Fort Collins Hospital. Really want to see that become a joint replacement focused institution, because the institution also becomes an expert in doing these procedures when you do them over and over and over again. So I'm looking forward really to helping to morph what we have here into that really super specialized center where people want to come because they know they're going to get the greatest care, and they're going to have wonderful outcomes.
Thank you, Dr. Kindsfater, for sharing your insights on joint replacement surgery and the complexities and the care that you bring to our community and to Northern Colorado here at Banner Health. It has been incredibly informative. So thank you for being here today.
You're welcome. Look forward to the next number of years.
Thank you for joining us today and making the rounds. And if you found this conversation as informative as we did, please subscribe to our podcast for more discussions on important medical topics. To learn more about Dr. Kindsfater and the orthopedic services provided at the Joint Replacement Center of Northern Colorado at Banner Health, please visit bannerhealth.com/orthopedics. Thank you for listening, and we'll see you next time on Making the Rounds.